We begin with the renewed efforts nationwide to control the worsening coronavirus pandemic. Johns Hopkins University is reporting nearly 11 million cases in the U.S. since the disease was first discovered. Health officials say more than 184,000 Americans tested positive for the virus on Friday, shattering the previous daily record. Hospitalizations also hit a record high for a fourth consecutive day, reaching more than 68,000. And an average of more than 1,100 Americans have died each day from COVID-19 related illnesses since last weekend. President Trump says he expects Pfizer's vaccine to receive emergency use authorization in the coming weeks, but it still needs to be cleared by the Food and Drug Administration. The president also announced he would not issue new national restrictions. Meanwhile, New York City began new restrictions on dining and gyms on Friday night, and the city's schools could be closing as soon as Monday. Michael George shows us what else communities around America are doing to slow the spread of the virus.
Intensive care beds in Utah, where they can find staff, are all filled. And Utah's daily number of cases there jumped to nearly 4,000 at one point this week, signaling to other states they need to act. Massachusetts did Friday.
We're announcing today that we're going to reestablish a field hospital with 240 beds.
During the spring surge, Massachusetts had to use field hospitals to take care of the overflow of patients. But now, as every state sees a surge, the disparity between states on what to do remains deep. Take masks. 28 states mandate masks be worn, while 10 don't. Idaho is one of them, and its governor hopes to appeal for common sense.
This comes down to personal responsibility. Please wear a mask when you're around another person who's not in your household.
In contrast, Oregon's governor Friday ordered a 2-week freeze on the number of people who can contact each other.
It's about social get-togethers, which are limited to 2 households or a maximum of 6 people.
Even college football has taken a tough stand. After Arizona State football coach Herm Edwards tested positive, the ASU-Cal game is called off. And so are at least a dozen college football games that now won't take place this weekend, including matchups featuring 3 of the nation's top-ranked teams, Alabama, Ohio State, and Texas A&M. Then there's the upcoming holidays.
That makes it very problematic, because people out of necessity will be congregating indoors more than outdoors. This is a particular issue as we're approaching the holiday season of Thanksgiving. 1 in every 378
Americans tested positive for the virus this week, and a projection: the surge will be at its height in January. Dr. Michael Osterholm is a newly appointed member of President-elect Biden's virus task force.
We're going to see by far the darkest days of this pandemic between now and next spring when vaccine becomes available. Now we're running in the 120 to 130,000 cases a day. Do not be at all surprised when we hit 200,000 cases a day.
Joining us now is Dr. Celine Gounder. She is a member of President-elect Biden's COVID-19 Advisory Board. She's also a clinical assistant professor of medicine and infectious diseases at New York University. Dr. Gounder, thank you for joining us. Can you talk more about what the nation is seeing right now? What's driving this explosion in case numbers, and what are your biggest concerns?
Well, the weather is getting cooler, and so people are spending more time indoors. You have children going back to school. You have folks who are working a little bit more in the office than they had been the last several months. And I think people are also getting fatigued of the social distancing and mask wearing and many of these measures. But I think probably the biggest driver is the cold weather and being indoors. Now, in the coming weeks ahead, we have a number of holidays: Thanksgiving, Christmas, Hanukkah, Kwanzaa, a number of holidays, which people will want to celebrate. And I understand that they'll want to celebrate with their family and friends. The problem is we have a fire raging across the country right now. And because the way that we would gather socially for these holidays in person would be such high risk for coronavirus transmission, it's essentially like pouring gasoline on that fire.
Oh, well, we continue to hear about cases of spread being traced back to people gathering indoors without masks. As a member of President-elect Biden's COVID Advisory Board, please clarify, what is the position of Mr. Biden on a national mask mandate, and what can the country expect once Mr. Biden takes office?
We strongly believe that masks work. The science shows that masks will protect the person who's wearing the mask as well as others. And it's really unfortunate that masks have been so politicized. This is a basic hygienic measure like using toilet paper. It would be like politicizing toilet paper. And this is a very cheap, effective measure that will block the coronavirus and that does not have an impact on the economy. So this is one of really the best tools in our current toolbox, and we really strongly encourage everybody to take personal responsibility for themselves, their family, their communities by wearing a mask.
I hear you, doctor, but as you mentioned before, there's a lot of pandemic fatigue, and we see these numbers skyrocketing. So what is the advisory board looking to do to actually boost compliance with these mitigation steps? This is the same message we've heard for a long time, that masks are effective, that they're responsible, they shouldn't be politicized, but we still see that there is spread happening because people aren't wearing masks. What more are you going to do?
Well, I mean, there has been discussion of mandates, but the problem is, how are you going to be able to enforce that down to the individual level? I think this is really a massive behavior change, social marketing kind of situation where we need people, one, to believe that masks work, two, to feel comfortable wearing them, and three, for this to become a social norm. And what's promising on that front is if you look at data, in fact, some of this was recently published by the CDC, at how well people are doing things like wearing masks and social distancing and so on, people are actually getting better at the mask wearing. They're not perfect. They may not do it all the time, but more than 90% of Americans are now wearing masks at least some of the time. And so it clearly is becoming a social norm. And I think we just need to keep reminding people, look, this is becoming normal. You're not going to stand out if you do wear a mask.
Dr. Gounder, can you tell us a little bit more about your role on the advisory board? Have you or anyone else from the board been in touch with the current White House task force officials? And how will you know where the PPE stockpiles are? If you're not actually in touch because the transition is not taking place, how much does that hamstring you?
I have not been in touch with anyone on the current White House coronavirus task force since being appointed to the Biden-Harris advisory board. And this is really problematic that we are not having a smooth handover of information and power during this transition period. We are at war with the virus, and it doesn't really matter whether this is a virus, a terrorist attack, or an armed conflict with another country. It is a war. And in the absence of this critical information, our national security is quite frankly at risk. This is a risk to the health of people in the United States. It's also a risk to our economy.
Well, last week, the country's largest domestic maker of N95 masks told CBS Money Watch that the demand for PPE continues to far exceed supply. How does the incoming administration plan to get hospitals and nursing homes the supplies that they need, particularly if you're not being fully brought on board with what the current administration is doing? And very soon, this will become your responsibility.
Yeah, and this is something that really I feel acutely. I was just on the wards at Bellevue up until the middle of this past week, seeing patients. And so I have, I've cared for COVID patients. I have had the same face shield in the hospital since March. We are still in rationing mode with our N95. So this is a very real issue. And now that we're seeing a surge, those scarce supplies are going to be spread even thinner. Now, one thing many of us have been pleading for from the front lines is for the current president, current administration, to invoke the Defense Production Act. And I think you will see one of the first executive actions that President-elect Biden takes is to invoke the Defense Production Act. What that would mean is that they can then commandeer, pressure manufacturers in the United States to massively scale up production of all of the personal protective equipment we need.
Well, speaking of ramping up production, it isn't merely PPE. Obviously, this leads into the question about vaccine distribution. Yesterday, President Trump says he expects Pfizer's vaccine to receive emergency use authorization in the coming weeks. That announcement came just days after the company announced its experimental vaccine is over 90% effective. Are you currently working on a distribution plan? And what are your concerns about distribution, especially in smaller and rural communities?
I think that's a great point. Smaller rural communities are going to be far more challenging. They're going to be farther in distance from the centralized locations where we will have the deep freeze capacity that a vaccine such as the one that Pfizer is producing will require. They also don't have as many of the CVS and Walgreens pharmacies that will be helping to distribute the vaccine. So rural areas are certainly going to be more challenging. I do think it's important to understand that this is not just being delivered by the federal government. In fact, much of the work is being done by local and state health departments, as well as cooperation with the private sector. And our team is already interfacing with all of those parties to make sure that this is smoothly distributed, at least as smoothly as possible.
Tell us a little bit more about that, because right now it is the Trump administration that is coordinating with these private entities, with these rural communities, with all of these state and local governments to try and work on a vaccine distribution plan. If you're also talking to them, is there coordination? Are we at risk of having two different plans being brought before these agencies and groups that are trying to get distribution out to the communities as soon as possible?
I mean, that would imply that you actually have robust planning being conducted by the current administration. Again, I think we're being very proactive about interfacing with the big players in this distribution effort, including the folks at CVS and Walgreens and local and state health departments, big hospital systems. They're going to be the ones on the front lines, and we are very much working hand in glove with them.
All right, one quick question before I let you go. New York City is contemplating closing their schools. This would obviously be a major development in the largest school system in the United States. Other major cities like Philadelphia and Minneapolis have already suspended their plans to reopen schools. What do we know about transmission and infections in schools, and what should parents and schools be doing right now?
Yeah, I think we're approaching big picture the control of the pandemic in the United States in a far more granular, targeted way. We've learned a lot over the last several months. So I think of this as a on-off light switch that we were using in the beginning of the pandemic, and we now have a dimmer switch we've upgraded. And so we should look at each of these settings, whether it's schools or restaurants, in terms of how risky are they for transmission and how essential are they as a service. And so from that perspective, restaurants, indoor dining is far riskier, far more likely to lead to transmission than are schools. And so they should be closed first, and schools not until later. Now, if you have widespread community transmission, which unfortunately is the case in many communities across the country right now, it's probably not safe to keep schools open at that point.
All right, Dr. Celine Gounder, thank you for spending so much time with us. And it's the first time, I'll admit, I've heard masks compared to toilet paper. So definitely a lot of new, interesting insight you have provided. Thank you.
My pleasure.